Hello, my name is Miranda Miles. This is my head-to-toe assessment for Nursing 612. This is my patient, JB. I have asked her to empty her bladder before the assessment, put a patient gown on. I have gotten a full set of vital signs on her. I've gotten her height and weight. I have assessed her gait. As she's entered, her gait is appropriate. I have assessed her vision, her far vision, with the Snellen chart and her close vision with the Rosenbaum chart, and that tested cranial nerve number 2. Her height and weight are appropriate, and now we'll begin my assessment. I'm going to wash my hands. Okay. Good morning, my name's Miranda. I'm going to be the one doing your head-to-toe assessment, okay? Now first I'm going to assess her general appearance. Her skin is intact. There's no apparent masses or lesions, rashes, any open places on her skin. I'm observing her head and skull. Her skull is normal cephalic. Her eyes are not wide set. Her ears are not low set. Her nose is midline. Her mouth is midline. Her hair is evenly distributed. There's not any apparent split ends in her hair. Now I'm going to palpate your skull, okay? All right. Okay, any tenderness here?
Nope.
Okay, all right, her skull moves. Now I'm going to palpate your sinuses, okay? Frontal first, any tenderness?
No.
Maxillary?
No.
Okay, now I want you to open and close your mouth for me, okay? This is for TMJ, and there's not any pops or clicks. Okay, now I'm going to have you to do some things with your face for me, and I'm going to test some cranial nerves. Okay, first I want you to smile real big, grit your teeth. Okay. Puff out your cheeks, okay, squint your eyes, and then crinkle your forehead. Okay, all right. Now I'm going to test your touch on your skin. I want you to close your eyes, and I'm going to touch you with this, and tell me if you feel it on both sides of your face.
Yes.
Okay.
Yes.
Okay.
Yes.
Okay, all right, and that was her cranial nerves 5, 7, and 12, and they were all appropriate. Okay, next, I am going to assess her eyes. Her eyebrows are evenly distributed. Her eyelashes are outturned. Her sclera it has no jaundice. There's not any swelling or drainage from her lacrimal ducts. Now I'm going to palpate her lacrimal apparatuses. Close your eyes. Okay, no masses or lesions. Any tenderness?
No.
Okay. All right, now I'm going to pull down her conjunctiva, and it is pink and moist. Okay, now I'm going to do the cover test. I want you to cover one eye and look straight ahead. Okay, there's not any nystagmus present. If you'll switch eyes. Okay, no nystagmus present. All right, now I'm going to check her pupillary reflex. I want you to look straight ahead for me, okay? Okay, reflective and consensual. Her reflex is appropriate and consensual. Okay. All right. Next, let's see. I'm going to check your cardinal gaze, and this tests cranial nerves 3, 4, and 7. I want you to follow my finger, okay, as I move it, and if you just won't move your head as you follow my finger. Okay. Now I'm going to test your convergence. Just follow the point of my finger. Okay. Okay. And that's appropriate. All right. Next, I'm going to assess her nose. Her nose, the skin on her nose is intact. I'm going to look up your nose. The membranes are pink and moist. Her septum is intact and not deviated. Her turbinates are not swollen. There's not any drainage coming from her nose. I've already tested her cranial nerve, her olfactory sense. Now I want you to cover your nose with one finger and blow out the other side. Cover the other side. Okay, and so both nares are patent. All right. Next, I'm going to look at her ears. The skin on her ears are intact, no masses, lesions present, any rashes. I'm going to palpate her ears. Any tenderness?
No.
Okay, all right. Now now I'm going to do the whisper test. I'm going to stand behind you. I want you to cover one ear. I'm going to say a word, and then I want you to repeat the word back to me.
Okay.
Purple.
Purple.
Okay.
Red.
Okay, perfect. All right. Now I'm going to do the Weber test.
Okay.
I'm going to hit the tuning fork, and I'm going to place it in the middle of your head. I want you to tell me when you don't hear it anymore, okay?
Okay.
Or tell me if you're equally bilateral. Sorry.
Yeah, it was equally bilateral.
Okay, you heard it on both sides.
Mhm.
Okay. All right, now I'm going to do the REN test, and that tests cranial nerve number 8. And I'm going to hit the tuning fork, place it on your mastoid bone, and then after I do that, then I want you to tell me when you stop hearing the noise. When you stop hearing it, I'll take it away, place it beside your ear, and you tell me when you stop hearing it then.
Okay.
Okay.
Now.
Okay.
Now.
All right, and air conduction was twice what bone conduction was, and that's appropriate. So I would test the other side as well. And let's see, I'm now going to look in your ears. Okay. All right. I see her TM. It is intact. There's not any increased cerumen light reflexes present, and there's not any excessive drainage in her ears. And I'll look at the other one as well. Okay, all right. Next, I'm going to observe her mouth. Her lips are pink and moist. Now I'm going to have you open your mouth for me, and I'm going to look on the inside of your mouth. Okay, she has 28 pearly white smooth teeth. There's not any dental caries present that I see, any fillings. If you need to close your mouth for a second, that's fine. Her tonsils are not present. Her uvula is present. Her posterior pharynx is pink. There's not any drainage or swelling back there. Her tongue is pink and moist. You'll raise your tongue up for me. Her frenulum's present. There's 2 Wharton ducts is present. And if you will stick your tongue out and go from side to side. Okay, perfect. That's also testing her cranial nerves. Excuse me, sorry. Let's see. There's not any odors coming from her mouth, anything like that. Now I'm going to check her reflexes. I'm going to put this in your mouth, and I say, ah. Okay. Her soft and hard palate raise, and they're both intact. And I checked her gag reflex, and it was present. So that was cranial nerves 5. That was 9, 10, and 12. And let's see. All right. Next, I will look at her neck. The skin on her neck is intact. There's not any jugular vein distension, no masses, no goiters, no lesions or rashes. I'm going to palpate her lymph nodes, her preauricular, postauricular, occipital, tonsillar, submandibular, submental, her posterior cervical, her superficial, her deep cervical, and her supraclavicular. Okay, and there's not any lymphadenopathy present in any of those. Now I'm going to have you shrug your shoulders for me, okay? And that was cranial nerve 11, and that was present. So I'm going to have you push against my hand with your head, okay? Push against the other side. Now I want you to bend your chin all the way down, bend it backwards, spin your head from side to side, and then try to touch your ear to your shoulder on both sides, okay? Okay, all right, good deal. Okay, now I'm going to palpate her carotids. I'm going to palpate her carotids. It's +2 on this side, +2 on this side. Her trachea is not deviated. I'm going to palpate your thyroid if you'll swallow for me. Okay, it moves freely. All right, now I'm going to listen to her carotids on both sides. All right. Okay. No bruise present. No bruise present. Now I'm going to listen to her thyroid. Okay. Alright. Now I'm going to assess her upper extremities. The skin on her upper extremities is clean, dry, intact. There's not any masses present. Muscle distributions equally. Now I'm going to palpate her shoulders, her axillary nodes. If you raise your arms up,
Oh, sorry.
that's okay. I feel those. There's not any lymphadenopathy. Now her upper arms, any tenderness?
Nope.
Okay, and her hands. Okay. And I'm checking her capillary refill, and it is less than 30 seconds. There's not any clubbing on her fingernails. Now I'm going to test her muscle strength in her arms. If you'll push up against my arms, okay, pull down, okay. Now push on my hands, okay, and pull back, okay. All right, and those are appropriate. Now I'm going to check her brachial and radial pulses, and they're both +2. And I'm going to check her brachial reflexes, okay. Okay, all right, and it was present. Okay, sorry. Now I'm going to have you spin around, and I'm going to assess your posterior back. Okay, all right. As I look at her skin's intact. There's no abnormal protrusions of her back. Her breath sounds are not labored. There's not any respiratory distress. The concave and convex of her back is appropriate. Her vertebral angles are appropriate. Now I'm going to put my hands on your back and I want you to take a deep breath for me. Okay, her chest expansions equal bilaterally. Now I'm going to touch you on both sides of your back, and I want you to say the word 99 for me.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay. And tactile fremitus is equal on both sides. Now I'm going to test her diaphragmatic excursion. I want you to bend over for me. All right, take a slow deep breath and hold it in for me. Okay. And I'm going to percuss up her back. Okay, all right, and I hear that point, and I'm going to mark it. Now I want you to take a deep breath, let it out, and then I'm going to percuss down. Okay, and I'm going to mark that point, and those 2 points are, let's see, between 3 and 5 centimeters, and that is appropriate. So next I'm going to percuss her back. Okay. And I'm going to percuss lateral. Okay. And now I'm going to listen to her breath sounds on both sides of her back. As I touch you with my stethoscope, I want you to take a slow deep breath, okay? Okay. 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 And I'm checking the laterals. Okay. Okay. All right. No crackles, wheezes, ronchi, any of those. And her breath sounds were equally bilateral. All right. If you will turn back around. Okay. Now I'm looking at her anterior chest wall. I'm noticing that it is equal, bilateral. There's not any protrusions. There's no open places on her skin, any masses, lesions, rashes. Now I'm going to touch you on your chest. I want you to take a slow deep breath. Okay. Her chest expansions equal bilateral. We're going to test tactile fremitus again. I want you to say 99 as I touch you. Okay.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay. All right. And tactile fremitus was equal bilateral. Now I'm going to touch her precordium, no heaves, or protrusions. Let's see. Now I'm going to listen to her lung sounds again. All right. If you will take a slow deep breath. Okay. 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 Okay, raise your arms up one. Okay. Okay. Alright. And I'm listening to her apical point. Okay. Now I'm listening to her heart sounds, her aortic, pulmonic, tricuspid, mitral, and Erb's point. Okay. Alright. lay down. And I'm going to listen to your heart sounds again. Aortic, pulmonic, tricuspid, mitral, iris point. Now I want you to roll up on your right side. And I'm going to listen at the exhale. Hold your breath for me. Okay, alright. Alright. And I'm also going to listen to her aorta. Okay, her renal artery, iliac, femoral, and femoral. Okay, alright. Now I'm going to assess her abdomen. As I'm looking at her abdomen, there's not any abnormal protrusions. Doesn't appear to be any hernias. Her skin's intact. Her umbilicus is midline. Now I'm going to listen to her bowel sounds first. Okay. This may be cold. I'm sorry. Her bowel sounds are active in all 4 quadrants. Now I'm going to press her abdomen. My hands are cold, I'm sorry. Okay, and that was appropriate. Now I'm going to percuss her liver. Okay, and I can hear that. And now I'm going to press her spleen. And I can hear dullness. Okay, now I'm going to do light palpation on her abdomen. Tell me if there's any tenderness. Does that hurt? Any pain? Okay. Okay. Alright. Now I'm going to palpate her liver. Take a deep breath and put one hand underneath her side. Okay. And I can feel her liver borders. Alright. Now I'm going to try to palpate the spleen. It's normal if you can't. Okay. And I can't feel it. And I'm going to palpate her left kidney. Alright. And I feel it. And her right kidney. Okay. And I feel it. Okay. And I would palpate her femoral pulses and a plus 2. Okay. Alright. Now, if you'll sit up for me. Alright. And as she was doing that, I was assessing her abdominal muscles, and they were equal. And there weren't any protrusions like hernias or anything as she sat up. Now, I'm going to assess her lower extremities. Her skin's intact. The hair distribution on her legs is even. There's not any masses, lesions. Her lower extremities don't have any redness, swelling, edema. Now I'm going to check her popliteal pulses, +2. Her dorsalis pedis pulses, and they're +2. And her posterior tibial pulses, and they're +2 as well. Okay, I'm looking at her feet. Her toenails don't have any clubbing. Her capillary refill is less than 3 seconds. I'm going to check her reflexes. Okay. Okay. And her Achilles reflexes. Okay. 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 Alright. I'm going to palpate your legs. Any tenderness or pain as I do this? Okay. Now I'm going to test the strength in your legs. I want you to push up against my hands. Pull back. Push up with your feet. Push down. Okay. Perfect. Okay, now I'm going to have her stand up. Alright. Now I want you to close your eyes. Alright, there's not any swaying. Okay, you can open your eyes now. I want you to bend straight forward. Okay, and I'm going to assess her back. There's not any kyphosis, lordosis. Any pain as you try to touch your toes? Nope. Okay. Alright, now I want you to bend forward, bend backwards, bend to the left. Sorry. You okay?
On the right.
Yeah. And just if you'll twist at your hips, okay? And then if you'll squat at your knees and hips, perfect. Now I want you to raise both arms up and put your thumbs up, and then if you'll flip them down like you're pouring something out. Any pain with that?
Nope.
And raise your arms straight up. Okay. Any pain with that?
Nope.
Okay. All right. You can sit back down. And this concludes my head to toe assessment. Thank you.